Broadway Mexico Self-Storage, how may I help you?
75-year-old Donna Parkins is battling cancer for the second time. She still works full-time at a self-storage facility in Denver, and she gets free housing above the office. But despite her benefits, Donna is worried that they won't last.
I paid into it my entire life, and now he wants to take it away from us.
He is President Obama. Like many in her baby boom generation, Donna's longevity may have a serious impact on Medicare. But in a recent study by Rice University and CU Boulder, people with higher incomes live on average about 5 years longer than those with lower incomes. Usually it's people with higher incomes who live longer and therefore make more claims and get more payouts. All of this is placing a huge strain on Medicare.
He's already raised our medical costs by taking away benefits. So I'm frightened that we'll lose our country to a dictator.
President Obama and Republican presidential candidate Mitt Romney have both advertised plans to fix Medicare. According to the Medicare Trustees report, Obama's Affordable Care Act will reduce spending by 1.3% of GDP in 2030 and 2.2% in 2040. The savings will be spent on expanding access to health insurance to 30 million Americans. But Medicare actuaries also predict that lawmakers will have to allow for faster growth in spending by 2035. Otherwise, beneficiaries will have a hard time finding providers that will accept their insurance.
A lot of doctors are saying they're going to quit business if it goes through, because they'll all be paid the same salary no matter what they do. So I'm scared to death for the future.
Romney and his running mate Paul Ryan say their plan for Medicare will not affect anyone currently 55 or older. According to PolitiFact.com, their plan will help future beneficiaries with fixed premiums depending on income. The voucher plan could be used toward a traditional Medicare plan or a private plan that meets standards set by the government. Romney says he'll restore $716 billion in Medicare spending reductions over the next decade.
Substantial changes are going to have to be made. Even if you want to roll back health care reform, there's a lot of other stuff you would have to do.
Marilyn Moon, vice president and director of the health program at the American Institutes for Research, calculated how much beneficiaries would pay out of pocket. She says under Romney's plan that co-payments and premiums would rise by $342 a year on average over the next 10 years.
I would like to put it back the way it was and be there for the future generations. It's worked well for us so far. It may need some fine-tuning, but they can do that without cutting all the benefits and raising our costs.
With all of the possible plans about the future of Medicare, Donna believes she and many others have good reasons to be afraid of what's to come. Ashley Hafer, News Team Boulder.